Hi. So, just gonna do a little bit of update here on what's gone on with me in the past couple days. So yes, I still have my feeding tube, though I am unattached to it during the daytime as I try to eat and see again how much my stomach can tolerate, whether it can tolerate some normal foods or not. And so far, hasn't gone very well. I'm still really, really nauseous and throwing up a lot and in lots of pain. So we have at least a diagnosis. I was officially diagnosed with gastro-perisi, which is a slowed emptying or partial paralysis to full paralysis of the stomach and word block, large and small intestines, and colon, etc. Pretty much everything below the stomach, which is like everything. So that's what's been going on. Some doctors want to treat it with just medication alone, though if you've been following my channel at all, you know that I have been on cocktails and cocktails of way too many medications, and it's just become so overwhelming and so ridiculous since my body is so taxed anyways. I don't think that adding any more medications to the mix is a great idea for me. We're going to end up taking medications to counteract symptoms and from the medications that I'm taking, so we're just going to end up in this like spiral of never-ending craziness. So personally, I don't feel trying medications alone is the best option for me, at least right now. And considering my past, I don't think it's the best option because I've been dealing with these stomach problems for years and years and years, and I'm like had it up to here. I am so fed up. I don't want to play this game anymore. So my alternative, instead of having this feeding tube, I'm going to have a GJ tube put basically into my just before the small intestines, and I will be tube fed when I can't eat, and will take my medications through there because I'm not absorbing any medication either. So trying to take anything orally isn't really going anywhere, and we will literally be just flushing money on medications down the toilet, and we can't have that. So they will put in the GJ tube. I'm not sure when yet. I'm waiting on the surgeons to come and talk to me. But I really feel a gut instinct about this, and I strongly feel that this is the best thing for me. Once they place the tube, it doesn't mean I have to use it. It doesn't mean that that is the only way I will eat forever. I will be able to take food in and keep myself nourished and hydrated, even if I'm having my bouts of nausea, vomiting, diarrhea stuff. So that's a really good side to it. One of the other sides is I could be on it for a year, 2 years, and realize that I haven't used it at all. So that would be another bonus to it. And if a couple years down the line we realize, oh, I really haven't used it at all, then they can take it out if they want to, if I feel that we're ready to have it out. But I could have it for 30, 50 years as long as I need it. And I feel really comfortable with this idea. So that's pretty much it. My mom's gone back home now, so it's just me during the days. And in the evenings, my husband will come and visit me when he can. I put on 1 whole pound, though, since being on this tube. So that's really good. I'm now 103 pounds. We'd like to get up to 125. Which going from 3 to 25 is like a really big jump, so it's going to take a lot of work. And Especially for me, won't be very easy. That I don't want to look like a skeleton anymore. I don't want to feel like crap anymore. I'd like to get my life back. I'd really like to go to school or start working or doing something other than sitting in these freaking hospitals. That's pretty much it. Right now, I don't know if you can tell, my room has been changed, but I am now upstairs on the cardiac and stroke floor because I had a seizure on Saturday night, and they asked to move me to a floor that was better equipped for those sort of things. And I have been taken off of the Reglan, thinking that those are adding to the seizures and tremors, even though I've had them in the past. The Reglan was just making them way worse, and Reglan's really not a good drug anyways, so I'm really happy to be off of that. Except it means I have to deal with the nausea a lot more. But maybe I could talk to them and see if we can switch to like the IV Zofran. This is why I have all these lovely stickers and this great cyborg box. They're monitoring my heart 24/7 to make sure that it's behaving, and then that way they can see any seizure activities from out there and know that they need to come in here and help me. I was really lucky that on Saturday night I was not alone. My mom and my husband and a nurse happened to all be in this room at the same time when it happened, which then led to calling the trauma team, and like had 15 different people in my room, and it was insane. Well, I think it was. I don't remember it, but I was told about it afterwards. So yeah, that's pretty much all that's going on here. So this room is a lot sunnier, a lot brighter, a lot bigger, a lot airier. I don't feel so confined and boxed in here. And I actually have a view out my lovely window. So that's awesome. I actually have a shower that I can shower in more easily, and people can help me shower in more easily. And yeah, so that's the update on me so far. I'll give you a little tour of my room very slowly. That is my gorgeous huge window. And that is the bed and the couch that turns into a bed that my husband sleeps on when he's here with me. That is the bathroom, which I can access way more easily. My awesome TV with the pictures my mom's been doing for me. My board and my chair. And the door and little nurse's center. And those are my lovely machines. My Joey and my IV and my BP monitor. And it's back to me. So that's what's been going on. Yeah, my mom will continue to update you guys on Facebook, and I will continue to share those. But trying to use the brain strength to write out a whole lot of info is way too hard for me right now. Even doing a lot of talking is really hard for me, and I'm exhausted now. It's been a very long day. I met with one doctor this morning that has been following me and doesn't feel that surgery is the best option for me, but he's only looking at the past 2 weeks. He is not looking at my past history, and he's not looking at my future. So we don't agree with him. He said ultimately it's my decision on what I want to do, and I really feel that this surgery is the best thing to do. So I will go and do that. Waiting for the surgeon, like I said, and I will talk to them, and once I know any more, I will do another video and keep you all updated. It's St. Patrick's Day, so happy St. Patty's Day to all of you guys, and I hope that you're all doing well, and thank you for following me, and I will continue to keep you updated as best I can. So I will see you all later. Thank you, everybody. Love you. Bye.